Well, it's time for us to begin. Good afternoon. I'm Dr. Sarah Qualls. I am a professor of psychology and director of the Gerontology Center at the University of Colorado, Colorado Springs. And I welcome you this afternoon. We're delighted to have you here. This is one of a series. We've called it our Winter 2021 series that's launching here in January as a continuation of the fall series. If you missed fall sessions, you can visit them at the CU Multicultural Center on Aging at Anschutz. They have a YouTube channel and you can view them there. I want to make sure that you know that we have 3 more topics in this winter series that will happen over the next 3 weeks. All of them have something to do with the brain. The first one is what to do if you notice memory problems. The second one's focused on keeping your brain healthy, healthy brain, healthy you. And the third one is living well with dementia for those who have achieved that diagnosis. I want you to also be aware that there'll be a reminder to fill out an evaluation following this session, and we'll be sending out the handout resources from today's webinar with that evaluation. And we always welcome you to share topics that you'd like to have us incorporate in future series. We're already in the process of planning one for spring. The Zoom login information for this series always arrives on Wednesday, so watch for that. And the YouTube channel and recordings are all uploaded to the CU Anschutz Multidisciplinary Center on Aging channel. We're thrilled to have community partners supporting this series, the Denver Public Library and the Broomfield Senior Services. I certainly want to introduce my co-host, Jody Waterhouse from the Multicultural Center on Aging at the Anschutz campus, who's not emceeing today, but she's in the background making sure all the technical portions go correctly. And most importantly now, I want to remind you that we prefer for you to keep your cameras off and be muted. That way we don't have any disturbance with the speaker, but we welcome your communication through the chat room. So open the chat, and if you'll put questions there toward the end of this hour, I'll be moderating some of those questions for the speaker, and you'll get to hear your question addressed. So now I want to introduce our speaker today. Dr. Sherry Gibson received her PhD in clinical psychology with an emphasis in geropsychology here at the University of Colorado, Colorado Springs. She's an instructor and a clinical supervisor for the psychology department here currently and a faculty affiliate with our Gerontology Center. She serves on the editorial board of the Journal of Elder Abuse and Neglect and is a member of the research committee for the National Adult Protective Services Association. And she's also a member of the Pikes Peak Elder Abuse Coalition. In addition to being an advocate for elder justice, Dr. Gibson has a private psychotherapy practice and consultation practice, which includes provision of capacity evaluation, expert testimony, consultation, and training. So without further ado, I welcome Dr. Sherry Gibson today to talk with us about anxiety and grief in challenging times, and give one final welcome to the people joining us here at the last minute and encouragement to turn off your cameras and please mute your audio. Thank you, and Dr. Gibson.
Thank you so much, Dr. Qualls, and thank you, Jody, for all of your support and for putting on such an important series during this time. I welcome all of you to this 1 hour together, and want to just maybe remind you that this is your hour. This is an hour for me to share with you some of the knowledge that I have around 2 important topics facing a lot of Americans right now, anxiety and grief, and also a time for you to ask any questions towards the end of my presentation. Well, we've all been affected, haven't we? And as I prepared for today's lecture, I felt like I wanted to take a collective deep breath together. So I would invite you to do that. Wherever you are right now, just settle in and let's just take a deep breath. We have really been through it, haven't we? The coronavirus has affected us in so many different ways. financially, socially, emotionally, physically, and psychologically. All of us have been dealing with the very real challenges of widespread illness, serious illness, and the inabilities of our healthcare systems to cope with it. We've all had disruptions to our daily life, economic fallout for many, many Americans, and obstacles and interruptions to our daily life, everything from schooling our children to being able to work. And the list goes on. The COVID-19 pandemic has resulted in enormous loss of life across the globe, and certainly in the United States. The collateral damage that this level of mortality would exact on American families cannot be overlooked. And it's important that the burden of bereavement and its potential mental and physical health consequences is factored into discussions of the public health challenge facing all nations. The pandemic also has documented that for some people, as a result of social inequities and how their identities are perceived and treated by society, are more impacted than others. COVID-19 has exposed this nation's longstanding social and political inequities in race, class, gender, national origin, and other factors. And in the fallout of the killing of George Floyd, we have witnessed an incredible display of hurt and righteous by marginalized Black and Brown people and entire communities across this country who could not sit back in the wake of that killing and those who came before George Floyd and certainly after him. And as those flames have been fanned once again in just the most recent week, as the tragic events unfolded in our nation's capital, about the inequities of even policing. So all of this against a backdrop of a pandemic where we have been quarantined for now many, many months. Well, it would only be, I guess, right to understand at this point the amount of stress and anxiety that has come from the pandemic. And although there's been substantial attention given to identifying persons with the coronavirus infection, identifying the mental health needs of people impacted by the pandemic have been relatively neglected, although I would say in the past months has started to get more attention. This is surprising, though, given that mass tragedies, particularly ones that involve infectious diseases, often trigger waves of heightened fear and anxiety and are known to cause massive disruptions to the behavior and psychological well-being of many people in a population. For example, in a recent study, it was a large survey actually of people highly susceptible to the coronavirus. These were Chinese healthcare workers. The prevalence rate of traumatic stress was at an alarming 73.4%, with depression at just over 50%. Generalized anxiety was at 44% and insomnia at 36%. And although those findings are quite disturbing, they're not isolated. As research on the physical impact of previous global outbreaks have demonstrated clear links between pandemic-related anxiety and elevated symptoms of stress, including contamination concerns, health anxiety, post-traumatic stress, and suicidality. Since 2007, the American Psychological Association has commissioned an annual nationwide survey as part of its mind-body health campaign to examine the state of stress across this country and to understand its impact. This survey is called Stress in America, and it measures attitudes and perceptions of stress among general public and identifies the leading sources of stress, common behaviors that are used to manage stress, and the impact of stress on our lives. The results of the survey draw attention to that serious intersection, I think, or complex interaction between physical and emotional implications of stress and the link between the mind and body. So I want to present just a few of the data, some of the data that came from here that I think relate to this particular lecture. One of the areas that was looked at in surveying this group of about 3,500 people was that there was a significant increase in stress related to the economy and to work during the pandemic when compared to a year ago, well, in August of 2019, and at the time of this survey in May of 2020. We saw a dramatic increase in stress due to the economy and also due to work. Parenting is another important aspect of American life that has been significantly impacted by the pandemic. I just want to mention here to please mute your microphone if you would, because thank you so much. There's just a little bit of feedback. Thank you. Parental stress and sources of stress has been documented in this survey. And you can see here on this slide that 2/3 of the people who were surveyed endorsed that having a family member getting the coronavirus, the government's response to the coronavirus, the disruption in daily routine or adjusting to new routines, and then the fear of getting the virus were really among the top sources of stress for many Americans. Also, access to healthcare services and missing out on major milestones that so many of us have gone through. There's also, from this survey, 7 out of 10 Americans say that the government response to the coronavirus was a significant source of stress in their life. And I can certainly understand that and can relate to this finding because there's so much information that we're constantly taking in, particularly at the beginning of the outbreak. And it was a changing landscape from minute to minute about what was safe, what wasn't safe. Could we wear bandanas on our face, or did we have to wear a mask, or did wearing a mask make a difference? All of the decisions that we had to make at an individual level, but also at the level of our families, our community, our schools, our healthcare systems, every point along the way, we've had to adjust and take in information at an enormous rate. And the sources of the information that are available to us are limitless. And so that can get confusing at times too, and contribute to our stress. I think what has been most profound for so many people is the context of dying during this pandemic. Many people have experienced just the shock of an unanticipated death. And you may have had that experience in your own personal life or have known people. This is the situation where a person seemingly very healthy comes down with the virus, goes into the hospital on a Friday, and is dead by Sunday. That type of shock and unanticipated death can certainly contribute to our stress. Family and caregivers being isolated from the person who is dying, high anxiety and feelings of helplessness in that fragmentation of caregiving and those important attachment bonds that have to be disrupted when families cannot be with one another during that transition from life to death. There's also an existential crisis. In my own private practice, I will say that many people have an existential crisis around this pandemic, where they're questioning the presence of God. And how could this happen? How could God let it happen? People questioning their own religious faith, and feeling the loss of their religious community, not being able to go to church or taking part in important rituals such as funerals. And there's a profound loss of meaning in that that's inherent in this context of dying during a pandemic. Disproportionate loss within minority communities that's been well documented throughout the pandemic. And medical systems that are overwhelmed by not having those important family supports that play a key role in care, particularly at the end of life, where medical providers, nurses, depend on family to either share information about the patient or to be available there to help in their care. And now those systems are overwhelmed in having to provide all of those, the complexity of care in ways that they've never had to do before. Grief reactions vary depending on who we are, who we lost, and our relationship to the person we lost, the circumstances around that person's passing, and how much that loss affects our day-to-day functioning. Different people may express grief differently. You may have even a very different grief response between one loss and another. Reactions to grief and loss include not just the emotional symptoms, but also behavioral and physical symptoms. And those reactions often change over time. All are normal during a short period. So here I've listed some symptoms that are often experienced. On the emotional side, people will feel shock or maybe denial, numbness, sadness, anxiety, guilt, fear, anger, and irritability. Behaviorally, people experience crying unexpectedly, changes in their sleep patterns, changes in appetite, maybe not eating or overeating, withdrawing from others, a restlessness, or trouble with making decisions, concentration. And physically, I would say concentration kind of falls into the physical as well, but an exhaustion, fatigue, decreased energy, problems with memory, upset stomach, migraines, headaches, and chronic pain. All of that can be a part of a physical symptom. We also see some more abnormal symptoms, such as the use of drugs and alcohol, or suicidality, that warrant really reaching out to a professional for additional help. Research shows around grief that an average recovery time is 12 to 14 months, and that grief reactions can be stronger around significant dates, such as anniversaries of a death, or birthdays, or the first holidays following a death. There's also a term and a diagnosis called prolonged grief. And the international, the ICD, and I just had, sorry, international, gosh, why am I forgetting this? Categorization of diseases. I'm sorry.
Classification.
Classification. Thank you, Sarah. Thank you so much. Worst thing to happen when you're, giving a public talk. Anyway, ICD-10 lists the criteria for prolonged grief. So obviously there's been a death of a very close person. There's a persistent and pervasive grief response that's accompanied by a long preoccupation with the deceased, an intense emotional pain that brings in all of the things that I brought up on the earlier slide, but it's intense and it's ongoing. And it lasts for a minimum of 6 months following the death, that exceeds all social or cultural norms. there's significant impairment in the person's personal, family, social, occupational functioning. So this is the situation where the person can't go to work, or can't take care of their family or their children, can't hold down relationships or jobs, and just isn't functioning in their everyday life. And that's what prolonged grief can look like. During COVID-19, one of the things that is, I think, germane to this time for us is that we are grieving in isolation. And that's somewhat of an oxymoron, because in many cultures, including our own, mourning is a shared experience. We are seeing a spike in COVID-19 related prolonged and complicated grief. And I don't think we have truly understood what this is going to look like over the long term. But there is an urgency in the need for timely access to mental health services during this time. It's also given us an opportunity to rethink or think creatively about how we approach bereavement. So we can look back on what we've learned from previous pandemics, such as Ebola, and we can also think about other ways to build connection, just like we're doing here now, where we can't be in the same room, but we're using technology to connect and to communicate. So now funerals are being live streamed. Physicians and chaplains are now using technology to help families connect, say goodbye to a critically ill loved one, and to deliver last rites. We're calling this now in the literature a new era of e-mourning. So where do we go next? So I wanted to kind of lay out for you a landscape of what the problem is and what are the things that people are reporting that they are experiencing in terms of their anxiety and stress and grief. And I want to introduce one of many strategies that can be used. And this is one that I have been using quite a lot in my own private practice. So Dr. Russell Harris, who is a psychologist well known for his development and education in a certain type of therapy, it's called acceptance and commitment therapy, has set about some practical steps using an acronym to respond effectively to the corona crisis using principles of acceptance and commitment therapy. And this is a quick summary, and I'm going to dive into what each of these mean. But he developed an acronym called FACE COVID. The F stands for focus on what's in your control, acknowledging your thoughts and feelings, coming back into your body, and engaging what you're doing. COVID is committed action, opening up, values, identifying resources, and disinfecting and distancing. And all of you by now should have received from Jody in your email a copy of this ebook from which I get this information. And you can use this. Dr. Harris has generously shared it with all of us to share. So please feel free to download that and keep it and use it for your benefit. So I want to go into each of these. Oftentimes when we are feeling anxious, we feel as if we're not in control, that the things that are swirling around us are completely out of our grasp. And I think that that's truly how many of us have felt during this pandemic. Fear and anxiety are a normal, natural response for us to respond to danger and uncertainty. It's all too easy to get lost in the worrying and the ruminating about all sorts of things that are out of our control. What might happen in the future, how the virus might affect you or your loved ones or your community, your country, our world, and what will happen then, and just so on and so on. While it's completely natural for us to get lost in such worries, it's not useful or helpful. So we want to focus on the here and now, because the reality is is that we all have far more control over our behavior than we do over our thoughts and feelings. So the number one aim is to take control over our behavior right here, right now, and be able to respond effectively in any crisis. This involves dealing with our inner world. Our inner world is all of our different thoughts and feelings, and our outer world, which is all of the real problems that we're facing. But how do we do that? When a big storm blows up, I want you to picture a boat in a harbor. The boat in a harbor has to drop anchor in order to stay steady, in order to wait out the storm. Because anchors don't control the weather, they keep that boat anchored until the storm passes. So, of course, I want you to think about dropping anchor as a way to get more control. So it holds us steady. These are the skills that you're going to be taught now that will help you kind of stay steady as the storm is brewing and as we're living through it and as it will eventually pass. So similar to any crisis, we're all going to experience that emotional storm. Those are the unhelpful thoughts that are spinning inside of our head, painful feelings that are whirling around our body. And if we're swept away by that storm inside of us, there's nothing effective that we can do. So the first practical step is to drop anchor. This is using what Dr. Harris refers to as the ACE formula. The ACE formula is acknowledging our thoughts and feelings, coming back into our bodies, and engaging in what we're doing. Silently and kindly, what we do here is we acknowledge whatever is showing up inside of us, inside in terms of our thoughts, our feelings, our memories, our sensations, urges. We want to take the stance of a curious scientist with ourselves, observing what's going on in our inner world. And as you do this, it's often very helpful to put it into words, silently saying to yourself something like, I'm noticing anxiety, or there's grief rising up again. There's my mind worrying. I'm having a feeling of sadness, or I'm having thoughts about getting sick. And while continuing to acknowledge your thoughts and feelings, you also want to come back into your body. Now note, when you come back into your body, we're not trying to turn away from or escape or avoid what's happening in the inner world. But the aim here is to remain aware of those thoughts and feelings, continue to acknowledge their presence, and connect with your body to actively move it. Why is this important? It's important so that you can gain as much control as possible over your physical actions, even though you can't control your feelings. Remember, the F was to focus on what's in your control. So as you acknowledge your thoughts and feelings, you're coming back into your body. And I've listed here some ways to do that. Very easy ways, even if you're sitting in a meeting or you're with others, that you can do. Slowly pushing your feet into the floor, straightening up your back or your spine to sit upright, pressing your fingertips together, maybe stretching your arms, your neck, shrugging your shoulders, or just taking some slow, deep breaths. And while you're doing that, and once you've done that, you want to engage fully in what you're doing. You want to get a sense of where you are right now and refocus your attention on the activity that you're doing. Find your own way of doing this, but you might want to try a couple of these methods that I've included. One is to just look around the room and notice 5 things that you can see. Now notice 3 or 4 things that you can hear. Notice exactly what you're doing now. Sometimes I like to notice just the minute details in, say, my coffee cup. Just staring at it for a few moments and just fully putting your attention in that one thing. And then you want to end all of that by giving your full attention to the task at hand. So you can see when you've done all of this, focusing on what's in your control, then dropping anchor by acknowledging your thoughts and feelings, coming back into your body and engaging, that now you can be fully present in the here and now. Dropping anchor is really a useful skill. It's useful in kind of handling those intrusive or the thoughts and feelings that you can't stop from coming in. Maybe it's emotions and memories. It can help you manage these more effectively. It also helps us to switch off that autopilot and engage fully in our lives. Helps with grounding ourselves, steadying ourselves in really difficult situations, disrupts rumination, obsessing, worrying, and again, puts us back into living fully in this moment. The better you can anchor yourself in the here and now, the more control you will have over your actions, which makes it so much easier to do the next steps of COVID. Remember, COVID. C stands for committed action. Committed action means effective action guided by your own core values. What do values mean? To me, values are what's meaningful to you. Usually values end in ing, such as spending time with my family, learning new things. These are values. Action you take because it's truly important to you. Action you take because even if it brings up difficult thoughts and feelings. I can really relate to this because for me, committed action is the work that I do in elder justice. And that's a difficult area to be committed to because it involves a lot of suffering and a lot of pain. But despite that, it's the thing that is part of my core value and therefore draws me into leaning into that action. So using these skills will help this make easier for you, I will say. Now, obviously, this includes other protective measures against coronavirus, which I'm going to talk about later, like frequent hand washing, social distancing, and so on, because as we're doing actions, we want to make sure that we're taking care of ourselves. But in addition to those things, there are fundamental effective actions. So I've listed here a couple of questions that you can ask yourself. What are some simpler ways to look after yourself or those you live with or those you can realistically help? If you're spending a lot more time at home during quarantine, which most of us have been for a long time, what are some effective ways that you could spend that time? What are kind, caring, supportive deeds that you can do? Or are there some words that you could say to somebody who's in distress, either in person or through a phone call or a text message? You want to repeatedly ask yourself throughout a day, what can I do right now, no matter how small it may be, to improve my life or the life of others that I live with or work with or people in my community? And whatever that answer is, you want to do it and engage in it fully. Maybe you can comfort somebody who's sick, or help somebody with a task or a chore or a meal, or simply hold a person's hand, play a game with a child, comfort somebody who is sick. O stands for opening up. Opening up is kind of like the A in face, where we acknowledge those thoughts and feelings. Opening up makes room for difficult feelings to come in and being kind to ourselves in that process. Difficult feelings are guaranteed to keep showing up for all of us as this crisis unfolds, even as we get vaccines, as we await for vaccinations. That fear, anxiety, maybe anger, sadness, guilt, loneliness, frustration, confusion, and more. We can't stop those feelings from arising. They're normal reactions, but we can open up and make room for them, acknowledge that they're normal, and allow them to be there, even if they hurt, and treat ourselves kindly in that process. Remember, self-kindness is essential if you want to cope well with this crisis. You can ask yourself this: if someone I loved was going through this experience, feeling what I'm feeling right now, if I wanted to be kind and caring towards them, how would I treat them? Again, it's turning that care inward, something that I talked about in an earlier presentation I gave on compassion fatigue. What would you say or do to that other person that then you could do for yourself? Try treating yourself in the same way as you would towards somebody else who was feeling those difficult emotions. V is for values. Some questions that I think are important here is to maybe ask ourselves, what do we want to stand for in the face of this crisis? Committed action, as I spoke about earlier, should be guided by core values. Your values might include love and respect, family, humor, patience, courage, honesty, openness, or numerous other things. There's many, many values. You want to look for ways that you can sprinkle those values into your day. Let them guide and motivate your committed action. And I like this second question that I've put on this slide. I ask myself this a lot, especially when I'm not coping well. What kind of person do I want to be as I go through this? And this last question, what can I say and do that will enable me to look back years to come and feel proud of how I responded during this time? I want to sit on that for just a second, because we have ways in which we can be effective. And of course, there are going to be days that we're not effective. There are going to be days that we fall apart, that we don't cope well. And we can be non-judgmental, and we can be gracious towards ourselves, even giving ourselves permission to not be our best selves on certain days. But as we pick ourselves back up, how do you want to look back on this time and remember how you were during this crisis? That's a question that I use a lot in my own practice, in my own work with myself, in my own time of self-reflection. What kind of partner do I want to be during this time? What kind of friend? What kind of daughter or sister or professional? And how would I want to look back on myself during this time and think about the things that I did and the ways that I reacted or acted or responded? I is for identifying resources. We want to identify resources for help, assistance, support, advice. I've listed on here one resource that might be helpful because I do a lot of work in long-term care. So for those of you who are on the call who either have family members, loved ones who live in assisted living or skilled nursing communities, or those of you who work in the healthcare professions, the National Consumer Voice, who you can find online, nationalconsumervoice.org, has some wonderful resources to keep families connected, and also resources about tips on self-care, tips on coping with the crisis, communication and technological assistance, tons of resources. But you need to know in your own profession or your own life role, what are the resources that are available to you? An important aspect of this process is knowing who the reliable resource is and where is the trustworthy source of information from which you get your guidance or guidelines. The World Health Organization is one place. I also look to my own professional organization, the American Psychological Association. But all of you out there should know where that trustworthy source of information comes to get your information and guidelines. So know what your resources are, identify those so that when you are having trouble or when you are needing some advice or guidance, you know where to look for it. And we can't say enough about disinfecting and distancing ourselves physically, washing our hands regularly, practicing social distancing as realistically as possible. But remember that physical distancing does not mean cutting off emotionally. And in fact, I was reading an article by a task force at the beginning of the COVID quarantine of the pandemic, and there were a group of psychologists who had actually made recommendations that we not refer to this as social distancing, but as physical distancing, because social distancing, just that term alone, implies that we are cut off from relationship. And that's not what we want to do. We want to distance ourselves in proximity to keep ourselves safe, but it doesn't mean cutting off from each other socially in creative ways in which we can connect. These actions, if you can see them as just truly caring in nature, remembering the golden rule, do unto others as you would want done unto you. And so treating others in a way that we also need to be treated and respected in terms of our social distancing or physical distancing. Look, I just did it. It's so much in the media, isn't it? Physical distancing. Let's change our language around that. In summary, I've listed here again the FACE COVID acronym. Again, you have this ebook at your disposal. So I highly recommend if you're a community member that's attending this webinar, use this for yourself, with your family. If you're a professional on this webinar, this has been really a great resource in using with my clients. I want to also talk about how we address grief. I want to encourage you to find supportive people to reach out during your grief, taking really good care of your own health during that time. Postpone any major life changes. Consider writing down your thoughts in a journal. One of the things that has been known to be very helpful for some people is to keep a gratitude journal. And at the end of each day, or maybe at the beginning of each day, to just write 3 things that you're grateful for. But writing for a lot of people is a source of healing. It's a way to express everything that's going on inside of you, just for yourself, getting it onto paper. Participate in activities. Find a way to memorialize people who have died, if you are grieving, and that's going to look very differently right now. Some creative ways have come up. Some people like to release balloons. Some people like to write a letter. There are just various, limitless ways that you can memorialize the person who has died. Consider joining a grief support group or contacting a counselor for additional support and help. And if you're employed, you can also access employee assistance program benefits that often include free counseling services that are confidential and that are available to you. And so I think that a lot of people don't access those enough and forget that they're available. Also important to note is that loss is multifaceted, and so therefore grief is too. And I know that I have focused here talking about grief associated with death, But there's also grief that is non-death grief. And that's a loss that I think many people are feeling. The loss of what life used to look like for us, loss of activities that we used to be able to engage in, such as going to the movies, going to concerts, going to school, going to class, going to church. That is lost too, and is also experienced through grief. So we have to know that grief is, there's no one size fits all. My process is going to be very different from your process. And um, and grief can show up in very interesting ways. I have been at a funeral before for an acquaintance where I find myself sobbing during the funeral because it brings up past deaths of other people in my life. And so grief is very complicated that way and shows up in different ways. So you want to give yourself permission to bereave and to hold no expectations on the duration, how long it's going to last, what it looks like, and what it feels like. And as you do that for yourself, you want to also give permission to other people to do that too. And the final point I want to make here is that I believe truly that we have become a very creative and resilient society from this pandemic. I'm sharing with you here a picture of a skilled nursing facility who, like many across our country, have had to be very creative about people being able to see one another, connection between loved ones and family members. And this was a glass partition that this particular community had painted to be very pleasing, that people could stand at either on each side of it and see one another. There's also, if you haven't seen it, Fort Collins here in Colorado made national news by their development of what they called a hug tunnel. This has now been translated to other forms, but it was a plastic sheathing that ran the length of a hallway where people could insert their arms into these plastic sheets and embrace one another, actually feel one another. And so these are the ways in which we're becoming creative and resilient through this pandemic. And so I want to end on that note, and I want to open it up in these last moments for any questions or observations, thoughts that you want to share.
Thank you so much, Dr. Gibson. And I remind people that to feel free to put thoughts or questions in the chat room. One question that someone's asked is whether you find your own work, your counseling work with patients and clients during this physical distance restriction to be more difficult and less effective.
Well, more difficult in the sense that it feels, the anxiety and depression are much more exacerbated right now. But I would say that it's very effective. The work that I'm doing with people is very effective right now, because I think that where counseling particularly can be very beneficial is that that's the place where a person can feel heard, can feel understood, can have an hour that is truly just for them to talk about these very difficult experiences. And so it's been complicated, but I wouldn't say it's been harder maybe. I think it's been incredibly effective.
So one person asked if you would talk just a little bit about anticipatory grief and how that is an experience that relates to this talk.
Yes, and anticipatory grief is something that comes up quite a bit. And what that looks like is the person expecting that there's going to be a loss. They're anticipating that to happen. And that again is, whenever we're anticipating something in the future, that really is anxiety playing out. And so again, around that anticipatory grief, we want to talk about what is at the root of that fear? What is at the root of that anxiety? And focusing on what that person can do to have some control over that. What are the actions? You know, I've worked with some people who are anticipating even them getting sick. So then the conversation is, well, what are you doing to ensure your health? What more do you need to be doing? Have you been to a doctor? Are you eating well? Are you getting enough sleep? Are you exercising? So again, it's taking control over what we can do to bring that anxiety down and that anticipatory grief of what hasn't happened, what might not happen, but that is anxiety working at its best.
Thanks. Some people have commented about a couple of other ideas about that one can do for coping. One of them is getting into nature or using pets. And I was thinking, Sherry, that if I could listen to you talk all day, I would be very calm. You just have this very calming tone. And I was thinking about the use of apps. I wonder to what extent you're finding your clients really can benefit from hearing a soothing voice in one
Oh,
of the calming apps.
I'm so glad you brought that up, because on the next slide, I've got some resources here, but here is where that comes in. So I've listed here some free, very helpful apps. There's a great app called COVID Coach that was developed through the VA. In fact, one of our alums at UCCS was involved in this project. It's a great app. I have to say, please download it. It's wonderful. Headspace, Daily Om is another one. There's also one called 5 Minutes of Gratitude, and it's a daily gratitude journal that's done on an app. But that's a wonderful resource if people have the technology available through their phone or through the computer that you can engage with. Very useful. In fact, Headspace, when COVID was first out and we were quarantined, Headspace offered a free service to psychotherapists and counselors to help us manage in between our clients, help us manage with our own responses to the pandemic and our clients who were struggling. And it was such a great help. I used it quite a bit in the beginning.
Someone's asked if you could flip back to the grief resources slide
Oh,
again.
sure. Yeah.
And while you're doing that, so they can kind of grab some of that. Someone asked, that many of us are in the situation of needing to support someone whose very natural grief activity related to the loss of someone, whether it's COVID related or not, has been interrupted by COVID. So someone needs to travel to be with a loved one who's in ICU or after a death, but is very afraid to travel. What do you offer to us about how we can support one another?
Right. Thank you for sharing that. I have a friend whose mother just passed from complications of COVID, and she lives here in Colorado. Her mother was in California. Same situation. She couldn't travel there to be with her father, to have a funeral. None of that could happen. And I think the best thing that we can do is to be there for that person. If you are that person, to reach out to your support group, whoever that is. Lean on your faith. If you have a faith that you lean on, a higher power. I think as a supporter, as a friend of a person going through that, sometimes we want to fix. Sometimes we want to go into problem solving with that person. And I want to remind you that sometimes people don't need us to problem solve for them, but what they need is a space to talk about it, to cry about it. And what we can do is to just validate how horrible that feels, how helpless it must feel, and simply let that person have that space to do it. I think it's all about relationship and the way that we can provide that either in person or like we're doing now. I want to make how are we on time? One point about connection via technology, like what we're doing now. I've given multiple webinars since the pandemic, and I am really, I was shocked initially, but not so shocked now. People would write to me and say, I felt so connected. I felt so comforted by this webinar. I felt like you really understood me. And I thought that was kind of shocking because I thought, we're not seeing each other. We're not having a conversation. I'm not in the room with you. How is it that you feel comforted? And isn't that profound that we could have that effect on someone in this kind of situation? And so I want to remind you that all of you have the ability to be therapeutic in your relationships without being a therapist, by simply listening and being present, even when technology stands between you and me.
As you were presenting some of your questions earlier, Sherry, I was thinking how wonderful it would be to sit with a group of my friends and just talk about that on a video chat.
Yeah.
So I wonder if you're aware, have groups formed to try to kind of formalize what would have naturally happened perhaps at a cocktail hour over coffee, but now we have to do deliberately through video chats? I wonder if groups have formed to do that.
Mm. Do you mean like support people who don't know each other coming together to talk?
Or people who do. I was just
Yeah.
thinking, I would love to have a conversation with a group of my friends around your FACE COVID acronym and questions. I think that could be a very rich source of support.
I think you're right, Sarah. That's a really good point. And I don't know of that, but I can tell you that, I have a group of friends that we've played Mahjong for years. And obviously this has totally interrupted that. None of us can be together. But we have found a way to come together almost monthly. And sometimes we play Mahjong online with each other, but we spend a good hour just catching up and relating to how we're all doing during this time. And it's just been a really wonderful experience. So I think, that's definitely happening in my circle. I was during Christmas, I saw that there were apps where families could do like a white elephant gift exchange through technology. And I thought, God, this is so cool what's happening right now, where people can really connect and talk and share in these larger groups and families. But I would encourage that. I hope that this training has provided you all with some ideas of being creative about how you can reach out and maybe even use some of what you've learned here to have deeper discussions with your friends or family.
I'm gonna let us end on that note. That's such a positive note. I think without in any way discounting the trauma and difficulties of this period, it's important for us to, in fact, recognize that there has also been creativity and growth. And it starts, as you've said, by anchoring in the experience, not denying it, but anchoring it and acknowledging it and then moving on. And I love that many of us have had some of that experience. So I want to pass along to you. You'll see later many thank yous in the chat box, appreciation for your ideas and your thoughts. And I want to really thank you as well. I want to remind people who are still on the webinar that we will have another one next week that focuses on what you do when you are worried about your memory. And then the week after that is Healthy Brain, Healthy You. And the last week of this particular winter series is focused on dealing with loss through dementia. And so please remember that you'll get a Zoom invite if you've registered. You'll get it on Wednesday for the Thursday meeting. And thank you to Jody Waterhouse and her crew at CU Anschutz for partnering to provide that infrastructure. So thank you very much to all who attended. You'll receive handouts and an evaluation form, and I hope you will complete those and get them back to us, especially with any great ideas of other topics you'd like to hear about. Thank you for today. Bye-bye.
Bye-bye.